and which ultimately ramifies into smaller ductules and ultimately which ramifies into alveoli, which is called acinus. And this acinus contains the secretion, enzymes. We know different pancreatic enzymes like pancreatic amylase, lipase, and there are trypsin, which are made for digestion of the digestion of the food material. So the system of the gland is called the exocrine, and ultimately that is carried over to the pancreatic duct, and you know that pancreatic duct opens in the second part of the duodenum along with the bile duct. We know, we can see the bile duct in the second part of the duodenum. We know that is the yellow one is the pancreatic duct, and another duct we can see from above, that is a common bile duct which comes down, which goes behind the first part of the duodenum, and it goes behind the head of the pancreas, and ultimately this common bile duct or bile duct joins with the pancreatic duct, and they form a common pathway, common channel for opening in the second part of the duodenum, which is called the ampulla of Vater. That is this is the ampulla of Vater, which opens. You can see there is a major duodenal papilla. So this ampulla of Vater actually passes through the musculature of the second part of the duodenum and ultimately opens and the opening is called the major duodenal papilla. And what is the location of the major duodenal papilla? It is around 8 to 10 centimeters away, or 8 to 10 centimeter distal to the pylorus. Sometimes we can get another opening which is called minor duodenal papilla, which is 2 centimeters proximal to the major duodenal papilla. That is called minor duodenal papilla. And this minor duodenal papilla is for opening of the accessory pancreatic duct. Now, pancreas develops from two parts. One is ventral and dorsal pancreatic diverticulum. Okay. And ultimately these two diverticula actually joins to form this pancreas. The ventral pancreatic diverticulum contributes in formation of the head and the lower part of the head and uncinate process. And rest of the head, neck, body and the tail, it is been contributed by dorsal pancreatic diverticulum. One is in front, one is behind. The gut is going down. One is related to posterior aspect of the duct, that is called dorsal pancreatic diverticulum. One is in front, ventral pancreatic diverticulum. Now, the main pancreatic duct is being contributed by these two diverticula. That means the dorsal pancreatic diverticula and ventral pancreatic diverticula. And there is a connection between these two diverticula. That means the connecting channel between these two diverticula. So pancreatic duct, it starts from the tail of the pancreas, it goes downwards and towards the left side. Okay. From the, we know the tail starts from the hilum of the spleen. So it goes downwards, forwards and to the left, and ultimately it's open in the second part of the duodenum. So that the whole channel is being contributed by these two diverticula and the connecting channel in between. And what is the accessory pancreatic duct? It is the continuation of the channel which is already present in the dorsal pancreatic diverticulum. Okay. And it sometimes open, you can see the accessory pancreatic duct, that is yellow colored structure, which is been contributed by the, as per our embryological knowledge, that is been contributed by the dorsal pancreatic diverticulum. And it opens proximal to the major duodenal papilla. That is called duct of Santorini. And the pancreatic duct, duct of Watson. And this common channel, that is called ampulla of the Vater, it is been, there is a valve or there is a circular muscles which encircles this ampulla of the Vater, which is called, which acts as a sphincter. So name of the sphincter is sphincter of Oddi. Okay. Now pancreas has got head, neck, body, tail. There are so many structures. Already you have know the head has got some peritoneal relation. Behind the head, the major relations are the hilum of the kidney. That means the structures in the hilum of the kidney, that they are renal vein, renal artery, pelvis of the ureter, both renal vein, they come in relation. And behind this, and also the, we can get the right edge of the inferior vena cava. So these are the posterior relation, and most posterior relation is the bile duct. Now head, which it is prismatic in structure, triangular in cross section, it has got superior border, inferior border, and the anterior border. The body, superior border, inferior border, and one border is in between, that is the anterior border. And the head crosses so many structures, abdominal aorta. Okay. The posterior to the head, we will get the abdominal aorta. And also the left psoas major muscle, left cross of the diaphragm, so and so. Left sympathetic trunk, left celiac. So you can get so many things. Okay. On the posterior aspect of the head. On the anterior part of the head we know, and also we get the, posteriorly we get the kidney, anterior surface of the left kidney and the suprarenal gland, they are also in posterior relation. This relation of the structures you can remember best. How you can remember? Seeing the cadaver. Just lift up the pancreas in the cadaver, you can find behind you are getting, you will get the abdominal aorta, you will get the anterior surface of the left kidney. Okay, at these structures. Anteriorly, we know what are the structure forming the stomach bed. Already we have discussed. Within the stomach bed, we can get the body of the pancreas. So, the anterior surface and the inferior surface, here it is related to coils of small intestine. And the tail of the pancreas, what is the most important part? It is related to it is in relation to the hilum of the spleen. You know, spleen has got several surfaces. One is outer surface, that is diaphragmatic surface, and the inner or the visceral surface. Achha, before that, we can have the picture of the pancreatic duct. Okay, and here we can keep, and posterior to the pancreas, the body of the pancreas, we can find one vein is coming from the spleen. Spleen is there. Splenic vein. This splenic vein, and you can see from below there on the right side, that is the superior mesenteric vein. These two vein joints, you can see at the neck of the pancreas. Formation of the portal vein. Very, very important relation. You can forget everything. You should not forget, but you may forget everything, but you cannot forget the formation of the portal vein, which is formed by the superior mesenteric vein and splenic vein behind the neck of the pancreas. So, neck of the pancreas is very much important for the relation of this formation of the portal vein. Okay. And you can see another vein is coming from here. This is the inferior mesenteric vein. This inferior mesenteric vein directly joins with the splenic vein and ultimately formation of the portal vein. Now we can find that uncinate process of the hook of the pancreas. Hook-like. From the left edge of the head, we can see the hook-like. Uncinate means hook. What is the meaning of the uncinate? Hook. And it holds the vessels. And we can find the vessels just over the uncinate process. They are nothing but the superior mesenteric vessels. The vein is on the right side and artery on the left side. Okay. So, we know what is the level of superior mesenteric artery? L1, lumbar. It is coming from the abdominal aorta. So, here we can find just behind the neck, we can expect superior mesenteric artery also. Actually, at the junction between the neck and the body, we can find the superior mesenteric artery, and it will hold. It is it remains, it is held in position by the uncinate process. And ultimately it will, this vessel will appear over the third part of the duodenum. So third part of the duodenum is very much important for this relation, that is the superior mesenteric vessels. You can find any structure, any vessel that is hanging from the third part of the duodenum, that is superior mesenteric vessels. In your OSPI or in your ID, you can identify, if you can identify the vessels which is hanging from the third part of the duodenum, that is the superior mesenteric vessels. Now about that, what is the importance of the tail of the pancreas? I told you this pancreas is a mixed gland. That means it has got exocrine component and endocrine component. If we can see, this is the exocrine component which resemblance with the fish bone of herring fish. Actually, the development of anatomy or medical science, it is mainly contributed by the foreign teachers. So, as per their resemblance, as per their view, it is herring fish appearance. It might be an appearance of any fish bone. Choto choto মাছ খাও তো দেখো না, the main bone, and around the main bone there are axillary bones. So it looks like the fish bone appearance, and in between we get the area that which ends in, ultimately which these ducts and ductules ultimately ends in acini, pancreatic acini, and in between pancreatic acini we can find some islets of Langerhans. Islets means some area, okay, faintly stained area, where we can find several cells, alpha cell, beta cell, delta cell, PP cell. So there are many cells which secretes hormone, and these hormones are directly discharged into the circulation. That is the endocrine part. We know the beta cell secretes insulin. The pancreatic beta cell, from the within the islets there are the centrally placed beta cells which secretes insulin, and there are other cells which are alpha cells which secretes glucagon. Delta cells, there are gastrin, somatostatin, there are PP cells, pancreatic proteins are there which are being secreted. Now, about the spleen, spleen has got visceral surface, and within the visceral surface there are impression like gastric impression, renal impression, and colic impression. Okay, and there is a hilum. Okay, so that area that is bounded by the superior border and the hilum, that is the gastric impression. Inferior border and the hilum, it is the renal impression. And that is the medial end and the lateral end. And in between the hilum and the lateral end, that is the colic impression. And there we can get, in between the hilum and the colic impression, there is a pancreatic impression. So these are the different This is the schematic picture of the visceral surface. You can see the superior border is notched. Why? We know the spleen is formed from different splenic lobules. As per your embryonic knowledge, it develops from the dorsal mesogastrium, and there are the left layer of the dorsal mesogastrium. There is appearance in the dorsal mesogastrium. There is appearance of small splenic lobules, which actually gets fused and gets formation of the spleen. So the superior border is very much notched. So it has got one medial end towards which is directed upwards and medially, upwards, backwards and medially, and this lateral end which is directed downwards, forwards and laterally. There are some angles. This angle is called anterior basal angle. This is called posterior basal angle. Between the superior border and the lateral end, this is the anterior basal angle or the clinical angle. Actually, the spleen is very important for clinicians. In medicine, in the clinics, you will get splenomegaly. That means when it becomes 2 to 2.5 times more than its normal size, it appears within the left hypochondrium. Just below the costal margin, we can palpate. This is the anterior basal angle which we feel. So that angle is called clinical angle. Between spleen and the stomach, there is a peritoneal ligament which is called gastrosplenic ligament. Between the kidney and the spleen, there is another peritoneal ligament, linorenal ligament. And between the left colic flexure and the undersurface of the diaphragm, phrenico-colic ligament, and the right linorenal ligament is continued upwards up to the diaphragm. That is called linophrenic ligament. So that is also called the suspensory ligament. And the phrenico-colic is called the suspending ligament. So there are some ligaments. And within the spleen, we can find this hilum. Hilum is for the passage of splenic artery, tortuous splenic artery, which is coming from the celiac trunk, largest branch, which splenic artery moves over the superior border of the pancreas and goes behind, and ultimately it goes behind the body of the pancreas and ultimately it reaches the spleen. And within the hilum, it divides into 4 to 5 segmental branches. And ultimately it supplies the spleen, and from there 4 to 5 segmental veins are coming and they join and rejoins and forms the splenic vein, superior mesenteric vein becomes the portal vein. And within the spleen we get red pulp, white pulp, Malpighian bodies, and around the arteries there are lymphoid structures. We know that is the peri-arterial lymphatic system, PALS, okay, which forms the white pulp, and rest of the splenic material, that is called the red pulp. Red pulp is more, 75%, and white pulp is only 25% of. And there are splenic artery divides into divides and ultimately forms in formation. the penicillar artery, which is eccentric artery, that is, you know, in histology you can find the lymphoid follicles, and there is an eccentric artery, that is definitely the spleen. And splenectomy is done where in hereditary spherocytosis. Any problem regarding with the RBC or old RBCs, when it passes through the spleen, gets captured and there is culling of those cells, and ultimately we can find this divides into hem and globin components, and we know that. So ultimately, at the age of the lifespan, near about at the 120 days, in case of RBC. So these old and defective RBCs are get broken down. Okay. Spleen is very important structure when it around the 5 months of intrauterine life. It helps in formation of RBC, WBC, platelets, that means the hemopoiesis. But from 6 months onwards, it gets stopped. Splenomegaly appears in malaria, in Kala-Azar. You can see there is splenomegaly. From the third part of the duodenum. First part, second part, third part, fourth part. ঝুলছে কি? Artery from superior mesenteric artery. Superior mesenteric vessels. Superior mesenteric vessels. এই যে এত সুন্দর ভাবে এটা। আচ্ছা, আর খাজা স্পেসিমেন, খুব ভালো স্পেসিমেন না। যা আছে তাই দেখতে হবে। এই দেখো, এই পস্টেরিয়র সারফেসটা সবসময় আমাদের, এই দেখো এখানে ভেনটা দেখতে পাচ্ছ, এটা ভেনটাই রিলেটেড ভেন। এই ফরসেপ কার আছে? ঘুরে না, এটা পেঁচ খেয়ে গেছে, বুঝেছো? না, কেটে বাদ দেবে কেন? পেটে কাট দিলে কি করে হবে? এই যে পস্টেরিয়রলি এই যে ভেন প্লেনটা যে দেখছো, এটা হচ্ছে দিস ইজ আ স্প্লেনিক ভেন। ঠিক আছে, স্প্লেনিক ভেনটা দেখে আমরা এই যে দেখছি, এই যে পাস করে নিয়েছে না, এটা এইটা হাইলাম, তো হাইলাম অফ দ্য স্প্লিন, দ্য হাইলাম অফ দ্য স্প্লিন ইজ স্প্লেনিক আর্টারি অ্যান্ড স্প্লেনিক ভেন পাবো। ঠিক আছে, স্প্লেনিক আর্টারি হচ্ছে সবসময় টর্চুয়াস হবে। ওকে, এবার মোটামুটি এটা সোজাভাবে ধরা যাচ্ছে। আচ্ছা, এটা এই পোল, দিস পোল শুড বি, দিস ইজ আ স্প্লেনিক স্প্লিন, the duodenum, and it should be at a higher level. Higher level, spleen সবসময় higher level থাকবে। ওকে, ক্লিয়ার? আর এটা হবে the duodenum, and along with the head of the pancreas should be near lower. এই যে হেড, এই যে সি শেপের মধ্যে, within the C shape, this is the head of the pancreas. Okay, head of the pancreas, ঠিক আছে, head, neck, okay, neck. So এই যে স্ট্রাকচারটা, যেটা আমি হচ্ছিল, গন্ডগোল হচ্ছিল, Ultimately, it is hanging from the, this part is hanging from the third part. So this is nothing but the superior mesenteric vessels. Okay, holding. হ্যাঁ, আর এই যে একসাথে থাকবে, ঠিক আছে? তো এটা হলো আলটিমেটলি পাইলোরিক এন্ড, পাইলোরিক থেকে ফার্স্ট পার্ট, সেকেন্ড পার্ট, থার্ড পার্ট অ্যান্ড মোস্ট মুভেবল, এটা হচ্ছে তোমার ফোর্থ পার্ট। ওকে, ঠিক আছে? এইবার দেখো উইদিন দ্য সেকেন্ড পার্ট এই যে সার্কুলার ফোল্ডস, বুঝতে পারবে? সো মেনি ফোল্ডস, সার্কুলার ফোল্ডস, এগুলো হচ্ছে আমাদের টু ইনক্রিজ দ্য সারফেস এরিয়া। ওকে, তো এটা হেড গেল। তাহলে আমাদের এই যে জায়গাটা, তাহলে এটা আমাদের যে ভেসেল, এখানে থার্ড পার্ট থেকে এখানে দেখবো সুপিরিয়র মেসেন্ট্রিক ভেসেলস। ওকে, এটা প্যাঁচ খেয়েছে বলে আমাদের অসুবিধা হচ্ছে। তো আলটিমেটলি পস্টিরিয়র সারফেস দেখো, এইটা দেখতে পাচ্ছ, এটা আর্টারি অর এনি ভেসেল, এটুকুনি তো অ্যাপিয়ারেন্স ক্লিয়ার। এবার আমাদের জিনিসটাকে ধরতে হবে, এটা আলটিমেটলি কোথায় যাচ্ছে, গিয়ে হাইলাম অফ দ্য স্প্লিনে ঢুকছে। ওকে, সো আমাদের এখানে ইয়েটা পাচ্ছি, দেখো দিস ইজ দ্য, ইউ ক্যান সি দিস ইজ দ্য duodenum, which is divided into some parts. Okay, movable, fourth part. First part, this is second part, this is the third part, and movable one is the fourth part. The cut section of the second part, you can find there are so many circular folds. Okay, and over this fold we can get the villi. Okay, ক্লিয়ার? স্টমাকের দিকে যাচ্ছে, ঠিক আছে? এইবার আমাদের মানে ভালো স্পেসিমেন না থাকলে আমাদের এই অসুবিধা হয়। এই আমাদের এই কৌশিক, আমাদের আর স্পেসিমেন নেই, এটা প্যাঁচ খেয়ে উল্টে গিয়ে প্রত্যেকটা স্ট্রাকচার এমন হয়ে গেছে। হ্যাঁ, তো যাই হোক, আলটিমেটলি we can find the tortuous artery, that is the tortuous artery. Tortuous artery in the body is splenic artery. We can find that is a splenic vein. Okay, so this is the splenic artery. Okay, splenic artery, splenic artery, ঠিক আছে? স্প্লেনিক আর্টারি posteriorly, এই যে এটা যে দেখছো, এটা হচ্ছে ভেন, ঠিক আছে? এটা হচ্ছে ভেন, ঠিক আছে? So pancreas has got head, this is the neck, okay, and this is the body, and this is the tail. Tail is related to the hilum, so there are some impressions. One is gastric impression, one is renal impression, one is colic impression, and in between colic and the hilum we get the, আগে দেখাচ্ছি তোমাকে, দেখো, ঠিক আছে? এটা তো ডেফিনেটলি এই যে তোমার নচ দেখছো, এই যে নচ যখন দেখছো তুমি, এটা ঠিক আছে? গ্যাস্ট্রিক ইমপ্রেশন, রেনাল এইটা তুমি নচ দেখে তুমি সুপিরিয়র বর্ডার, এটা ইনফিরিয়র বর্ডার, এইটা দেখো এটা গ্যাস্ট্রিক ইমপ্রেশন, রেনাল ইমপ্রেশন, এই গ্যাস্ট্রিক ইমপ্রেশন ওপরে, ঠিক আছে, দিস ইজ দ্য গ্যাস্ট্রিক ইমপ্রেশন, এটা রেনাল, এটা যে কোলিক ইমপ্রেশন, এটা মিডিয়াল এন্ড, এটা ল্যাটারাল এন্ড, ঠিক আছে। এই যে এবার দেখো তো in between hilum and the colic impression there is a pancreatic, the tail of the pancreas gives the impression here, so that is a pancreatic impression. So there are this is the diaphragmatic surface, with it is held with 3 fingers, okay, that is the 9, 10 and 11 ribs. 9, 10, 11 ribs. Spleen obeys a Harris dictum 1, 3, 5, 7 and 9 to 11. 9 to 11, only 10 is the exception. 10 is an, all the odd numbers are comes in relation. 1 is 1 inches, 3 inches, 5 inches, 7 ounce and 9 to 11 ribs. So only exception is 10. 10 is the even number, but 10 actually is the, it is the axis, and this 10th is a rib and it forms the axis of the spleen. That means around this 10, spleen will move. Spleen, when there is a splenomegaly, so this anterior basal angle will move like this, okay. So 10 is the axis. Axis means around which the spleen will enlarge, okay. So this surface is related to the diaphragm and 10 ribs. 9th and 10th. The 9th and 10th intercostal space we will get here, and here we will also get the costodiaphragmatic recess in 9th and 10th space. So if biopsy is needed, we will choose the 9th intercostal space in the mid axillary line, because this goes up to the mid axillary line. Patient is asked to hold the breath in full inspiration. Then we have to count the ribs, and we will, and around the mid axillary line we will reach the space in between 9th and 10th rib, okay. So what is the renal impression? What is the renal impression here? Above is the gastric impression, below the hilum is the renal impression. Anterior surface of the part of the upper part of the upper and lateral part of the anterior surface of the left kidney and the suprarenal gland will come in relation, and এইটা ওখানে এখানে, আর এটা যে কোলিক গ্যাস্ট্রিক, হ্যাঁ কোলিক বাইরে এখানটা গ্যাস্ট্রিক ইমপ্রেশন, রেনাল ইমপ্রেশন, কোলিক ইমপ্রেশন, ওকে। This is the gastric impression. Renal impression below the hilum, renal impression, and lateral end is the colic impression. Which part of the stomach comes in relation? Anterosuperior surface. Anterosuperior surface of the stomach, not the posterior inferior surface. Because In the stomach bed, we do not get the spleen. We get all the structures like suprarenal gland, splenic artery, so many things, pancreas, body of the pancreas. They all forms the stomach bed, but spleen never forms the stomach bed. Actually, spleen is related with the fundus and the anterior superior surface. It is covered by the peritoneum. There are two layers of peritoneum. Then we are getting the diaphragm. So that fundus of the stomach and the anterior superior surface of the stomach, this comes in relation to this area. And this colic impression is for ascending colon, transverse colon, then is the descending colon. So there is a left colic flexure. That left colic flexure will come in relation to the colic impression. Okay. So left colic flexure. From here, one peritoneal ligament will continue up to the diaphragm. Phrenico-colic ligament. This linorenal in between the kidney and the spleen, this ligament is continued upwards, which is called linophrenic ligament. এরকম আছে তো এখান থেকে from here another peritoneal fold will come up and it will continue up to the diaphragm. This is linophrenic. Lino means spleen. Okay. ঠিক আছে. So this is the duodenum. Duodenum is accommodated with the paracolic gutter. ওদিকে চলো দেখাচ্ছি. Backwards and medially. Then the second part. Then the third part and ultimately the fourth part. So it is accommodated within the paracolic gutter. Here we are getting one muscle. That muscle is psoas major muscle. So it looks like this. Okay. It is accommodated within the paracolic gutter.